Having good oral health is vital to your overall health. Many current poor health conditions can be directly related to poor dental issues. To learn more about how we can keep up with our oral health, we visited Dr. Katie McCann-Lee at Aurora Modern Dentistry.
So many people out in the population don't realize how much your oral health affects your systemic health. People don't realize that whatever they put in their mouth actually goes into the rest of their body. And what we now know with disease is that inflammation is the root cause of nearly 95% of disease. So if we have inflammation going on in the mouth, we're guaranteed to have that going on in the rest of the body. So what we know now is that if you have poor oral health, you will suffer from things like heart disease, diabetes, dementia and Alzheimer's, certain cancers, inflammatory diseases, and even infertility issues. What we know that happens in the mouth is that we have certain bacteria that are present in the mouth. We have something called the microbiome, which everyone is familiar with gut bacteria. That gut bacteria actually got there from our mouth. Our mouth oral microbiome is what happens first. So we always want the bacteria in our mouth to be healthy and not be bad bacteria that can cause disease. But what happens in oral disease is that balance between the good microbiome and the bad microbiome gets upset and the bad bacteria take over. We know that those bacteria are what are linked to the systemic conditions I just talked about. And so steps that you can do to help mitigate that is to come in and see your dentist and actually run some saliva tests that will help determine what bacteria are present, what levels they're at, and actually if they're circulating the body. So the first test, the oral DNA test, is actually a swish and spit. So we have patients swish a liquid for about 30 seconds and then they spit it into a vial. That has to go off to a laboratory to be analyzed, and we'll get the results in about 7 to 10 days. The enzyme test we do chairside, which is really cool. It's a brand new test. We actually put they look like litmus paper strips. We put them inside the patient's gums and we run it inside our reader, and we have a result within 7 minutes. And what we know is that test is actually predictive of 18 months in the future of tissue loss. So what's really awesome about this is in dentistry historically, we've always been a reactive profession. We wait until we can see destruction and disease on x-rays before we render treatment. With this test, now that we know it's predictive, we can actually go in, realize something's happening in the patient's mouth before we can see it clinically and intervene and stop that degradation process. The first thing that people really have to do and realize to do at home is to take care of their teeth. Everybody should have an electric toothbrush. So whether it's Sonicare or Oral-B, it really doesn't matter. Just really ensure that you have a nice electric toothbrush, and you want to brush twice a day, non-negotiable, for 2 minutes each time. After that, you must floss every day, non-negotiable, before you go to bed. And then you want to pick a mouthwash that's actually gentle and non-drying. What you want to do is you want to kill the bad bacteria and leave the good bacteria to maintain your health. So I always recommend a super gentle mouthwash, non-alcoholic for sure, so that way you can make sure that your bacteria is balanced in your mouth. So Saved by the Mouth, my book that's going to come out in the spring, is actually a passion project of mine because it is something that I take so seriously every day, which is the mouth-body connection. It came about because every time I have patients come in, I find myself spending a lot of time educating patients on how they need to take care of their oral health so that they can be well overall. And my patients keep saying, why don't you write this down? Why don't you write a book so that everyone can have this information? Because what I'm finding is patients, once they're educated with this knowledge, they become passionate about it too. And then they have a family member that's suffering from, one of these ailments that's affected by oral health. And they want to go give the information that we're giving them to their friends and family members. And so this way I feel like once it's in a book, it'll be better able to be distributed to the public so that everyone has the tools and the knowledge they need to be well.
Dr. Katie McCann-Lee takes pride in educating her patients about their oral health and helping to restore them to that optimum oral health status. As her patient, you can expect her to create an environment in the dental office that is inviting and caring.